Well, after 30 years working in local healthcare, Catholic Health's longtime president and CEO is stepping down. Mark Sullivan's last day will be August 31st. We got the news this morning. He will be replaced by Joyce Markiewicz, who most recently served as Executive Vice President and Chief Business Development Officer. Sullivan started as an intern at Sisters Hospital in 1994. Nearly 2.5 decades later, in 2018, he became the healthcare system's chief executive. And joining us live tonight is Mark Sullivan. First and foremost, thanks so much for coming in.
Absolutely.
We talked so much during COVID, during the nurses' strike, during these really significant moments in your career, and I want to ask you about some of those. But first of all, I'm sure people are wondering, you have one of the best jobs. Best is
you're
an
correct.
Interesting word.
Best job.
One of the best jobs. One of the most perhaps sought after positions in Western New York. Why step aside?
Well, it's not about me. It's about the organization. And we were founded on a principle about doing what's right for the community. And as a CEO, you step back from your job, no navel gazing, and you look up and say, where's the organization? And typically, for all the studies I've seen from PwC to Harvard, says, a typical CEO is, 3 to 7 years. So I took a pause when the board met with me about renewing my contract and spent time with them. And, trust in healthcare, Michael, is so important. Yep. And it starts in the boardroom. So I could have very candid conversations. We really prayed on it. We had discernment amongst the board members or religious sponsors and talked about, hey, what's next and what should be the next step. And so I'm very excited. Today's a great day at Catholic Health for primary reason of Joyce Markiewicz being the next CEO.
Yeah, she is extremely talented. We, as I mentioned, talked a lot during COVID. I give you a lot of credit because you were always available, always took our calls, yep. Always talked to us. You went through that. You went through the nurses' strike. I mean, talk about back-to-back challenges for the CEO of a healthcare system. Yep. How are you reflecting in this significant moment right now on those two things?
I keep it in perspective, Michael. You have to go back 175 years. Our founders and foundresses came here during a cholera outbreak with no MBA, no internet, nothing, and they went door to door and raised money to start our health system. We're here to serve the community. So that always resonates with me, and having a great team. It's not about one person, it's about the culture, it's about the team, the trust, the commitment to the community. So no matter what was thrown at us, we worked through it. And today I had a beautiful call with the leader of the local CWA out of New York City, and we had a great candid conversation, very supportive and appreciative of our working relationship. And the same with COVID. It's not about COVID, it was about how we responded. And so we're really basing our faith and excited about the future of Catholic Health, but are ready for the next challenge.
There are so many challenges right now to healthcare, particularly for hospital systems. I mean, I don't know of a hospital around the country that is making money right now. It is so challenging with reimbursement rates and the cost of labor, and we still have a nurses shortage, so you're having to use agencies to bring those in. How do you define sort of the state of healthcare and specifically hospitals right now?
Yeah, I think healthcare goes beyond the four walls, and the Catholic Health's business plan is not about the four walls of a hospital. It's about serving the community where they want to be served. So the Lockport Hospital, for example, up in Niagara County is a great example of we did listening sessions, figured out what the community needed, and we built what they needed. It's really important that we try and curb the disease state of the community, not just serve the symptoms. So how do we improve the food pantries like we're doing at D'Youville University? A lot of things outside the four walls and really balancing that out. We hired over 2,800 people last year, over 650 nurses. Every orientation I go to every Monday morning has between 50 and 100 people. People love working at Catholic Health. They trust us because of our high quality, leading the region in that area. So we just have to stay steadfast to our true north, and I know Joyce is going to do a great job doing that as well.
I just talked to Joyce just a couple of weeks ago about the new hospital that's being built in Lockport. I know this is a really exciting time for Catholic Health. Again, despite all the financial challenges that are impacting every healthcare system in America, to be expanding right now and to be building what will be, it's a much needed facility in Niagara County.
Absolutely, and there's never the wrong time to make the right decision. And that's been our principle base at Catholic Health since we were founded. So the community was going to be abandoned, no hospital, over 80,000 people. That's what we're founded on. We can't abandon the people, the community. We went in and we came up with a temporary ED in the interim, and we're really focusing on making sure the community needs are met, either with partners or in this example, just us going up there and doing what we do.
You talked about as you have these orientation meetings every week. I mean, you're out there all the time recruiting, especially nurses, but there are a lot of open positions still in healthcare right now. How is that coming along and, bigger picture even outside of Catholic Health as you look at this challenge nationwide of being able to recruit the talent that you need to take care of all of us?
Yeah, I think the most important thing is if people understood what healthcare is all about, it's a calling. And at Catholic Health, it's a calling, it's not a job. And once people realize that, especially our ministry, ministry and our organization, they get hooked. So it doesn't matter if you work in dietary, every job is as important as the next. And so we really focus on the team effort. Much like the blizzard, we were open. We had grandparents moving into our hospitals with their pets, and we were taking care of them. That's just who we are. And so we're really excited to share that mission and that ministry with the people that come to recruit, that we recruit. And we're excited about the opportunity to work with everybody. So it's constant. It's going into high schools, it's going into grammar schools. I'll be speaking at Canisius University on Sunday to the leadership there. It's just making sure they know what it's about. It's not just what's in the media, it's also about the people that rely on us during the most vulnerable times. And we are in the mind, body, and spirit of healing. And if you want to be in a profession like that, Catholic Health is the place to go.
I'm out of time, but a little bit of time for golf, a little bit of time for travel.
No, I have two marriages. One is Catholic Health, and one is my wife of 33 years. So we're going to try and rebalance that. And I'm also going to spend time maybe going back to school. I want to educate the next generation of leaders.
Yeah.
So I want to resharpen my saws, Stephen Covey would say, and then focus on who wants to step up and be the next generation of leaders. Great day at Catholic Health. We pride ourselves on smooth transitions, unlike any other. And Joyce is going to be a remarkable leader. She already is. And I'm so excited to see her in that role September 1st. Well,
I can't thank you enough on behalf of our viewers for always being transparent and available to us during what were very difficult times with COVID and the strikes.
It's been an honor. Thank you so much. Yeah, thank you so much. Yep.